Good morning, beautiful people. If it's your first time over here, my name is Michelle and I'm one of the staff nurses practicing in the United Kingdom. I've been a nurse for almost 4 years, and in this YouTube channel, I share content about nursing, I share content about property, lifestyle, vlog, beauty, and all the good stuff. So if this is the topic you are interested in, please just don't forget to hanging around with me and to like my video, subscribe, share, and comment. And for those who has been here before, thank you so much for coming back. So in today's video, I am going to share one of my interview experience because I am looking for a job. Oh no, well, I am looking to change a job because I'm actually having a job, but I'm quite getting comfortable and I'm thinking like I need to find a place where I want to be challenged. So I've been in this job for almost 4 years since I graduated in 2020, and I feel like I need something else because I want to enhance my skills as well. So not long ago, I went for an interview, and I will just go through the interview and I will share with you 4 questions that I've been asked, and I will go through the question, and in the end I will tell you if I was successful for the interview or not, and what I could have done better. So without further ado, just let's go right to the topic. So I went to this interview and there were two nurses that were in the room waiting for me. There was a charge nurse and a senior charge nurse. So basically a band 6 and a band 7. For people that don't know, people who work in hospital, they are divided into banding, and for what concern nurses, newly qualified nurse or just a staff nurse is a band 5, and after you have a band 6 which is a charge nurse, and a band 7 which is a senior charge nurse, which is the ward manager as well. So when I came, I just sat, and both of the ladies tried to explain me how the ward work, and what type of patient they have, what is their specialty, and what is their basic routine, which was kind of good because I learned a bit more about the ward, and I had more information. So after this, they started to ask me some questions, which were 4 questions. The first question was like to talk about myself, which is always the same question that every time I go to an interview they will ask, and I think that it makes sense. So they asked me to talk about myself and to just introduce myself. So I started to introducing myself by saying that obviously I've been a nurse, and I mentioned the patient where the place where I work, and I mentioned the type of patient, and I even said why I would like to change a job and why I apply for this job. So please do not start to talk about the first day that you went into university until the time you retire, because they don't need that. They just need a brief introduction about yourself, your experience, and where are you working, and how come you want to change a job, and why did you choose to apply for this job. So just like a brief introduction, so they don't need to know a lot of stuff. It's just for them as well to know a bit about you, so they don't know details. So because if it's too long, I feel like 11-hour shift or 12-hour shift would be not enough, and the shift gonna finish, you're still there talking about yourself. So just being brief, and if you are newly qualified, just talk about the reason that make you go into nursing, your placement experience, and after that, why did you apply for that, and the type of support you would like to have that, and just basic stuff, and just be simple, because I think that sometimes less is more. So the second question they asked me is about patient-centered care, how I perform patient-centered care, and how I implemented in my day-to-day practicing. So if you don't know what is patient-centered care, that means that I don't know. Every nurse in the world must know what is patient-centered care. Basically, patient-centered care is the ability to practice by putting patient at the center of everything you do. So it's so important. You cannot be a nurse and you don't know what is patient-centered care. Basically, it's every nurse's daily bread. So I started to talk about person-centered care, and talk about how I implemented person-centered care. For example, making sure that everything I do is based on the nurse, on the patient interest, and reassuring that what I do is for the benefit of the patient. So I was brief, but I think that I answer quite well. So after that, the second question, actually the third question was, in case I realize that I prescribe the wrong medication, what will I do? So I started to say that I will report that to the nursing, to the senior nurse in charge, and I will monitor the patient to make sure that it doesn't have any adverse reaction to the patient, and I will reflect on it as well. So this is another question that is recurrent in the interview about wrong medication, because mistakes do happen, and I think that is the ability to go through that mistake and to learn from that mistake, and to after reflect on it and see what you have done wrong, and after that what you can do better in the future, just to improve your practice as well. So I answered those questions. I answered this question, and I think that I answered well, because I said that I will monitor the patient to make sure that it's fine. I will report it that, and I will make sure that the same mistake doesn't happen in the future. So that is the way I answer. The last question was, in case I see a confused patient, what will I do? So most of the time when you work in a hospital, you always deal with patients who are confused, because most people, the people that come to hospital, a lot of them are elderly living with dementia, and are elderly that have like mental decline. So most of the time they come confused, and their mental state just changed. So I deal quite a lot with confused patients, and I personally, the first thing that I will do when I see a confused patient is, like, for example, understand what is the reason why this patient is confused. So maybe try to talk to the patient, like use my communication skill and approach the patient, maybe offering a cup of tea, and sit down with the patient and try to understand why this patient is confused, and try maybe to ask if there's anything that they are looking for, because a lot of the time the elderly maybe, I don't know, they are looking for their own relative, because obviously they are confused, they don't know where they are. So what I will do is to try to talk to them and try to reassure them. And another thing that I will try to do is to understand maybe if there is any infection that going on, maybe by reporting that to the medical staff, and start maybe an investigation if there is any infection going on, because as we know, older adults, when they get an infection, they can be confused. So this is another thing that can like trigger confusion. So I will try to do that, and obviously I will report to the medical staff to start the investigation, and I will try to reassure them. And another thing that I usually do is I phone their family to ask if it's normal for them to be confused, or if it's this is their normality, and try to get more information and how will I be able to help them. And I think that one of the things that make a patient confused is like the change of environment, because usually people living with dementia, they try to, when basically they move from one world to another world, they tend to start to get confused, because obviously it's like moving someone from their comfort zone. So this transition from one place to another one, that is one of the reasons that made them confused as well. And usually it's come after moving from one place to another one. So that is one of the aspects as well I mentioned in my interview. So after the interview, those was the 4 questions, and they asked me after that if I have any question, and please try at least to have 1 question or even 2, because by asking a question you just show interest about maybe the place, and you just show interest, and you just show that you are the right candidate, and they are doing the right thing by giving you the chance to work with them. So the question that I asked was, since I'm gonna be a new staff nurse in this place, what are the support they are in place because I'm coming from a totally different experience. So me coming into this new place will means that I have a lot of things to learn. I have new stuff to work as a part of a team. So I asked that, and the charge nurse and the senior charge, they were quite good because they went through with me and they told me that there is like the PEF. The PEF usually is a nurse that is a like, in fact, PET stands for Practice Education Facilitator, which is like a kind of a teacher on the ward. And if you have any problem, you can ring her out or even email her, and then she's gonna come and explain you and try to solve basically your problem. It's like your teacher in university, but you have it on the ward. So they are quite are good people to reach out when you have issues. So they mentioned about having the PEF in the world. They mentioned about having other people in the world. For example, my nurses, that the other nurses that like have more experience than me, so I can anytime reach out of them. And they went through because another question that I asked, what is your daily routine? And they asked me what they answered to me what they do in the morning, what they do in the afternoon, what they do in the evening, and overnight as well. So I roughly have a clear idea about how the world work. And after answering those questions, and they told me that they will see me. Basically, they will give me a call later on to let me know if I'm successful or I am unsuccessful. So after that, I went home, tried to chill down and try not to think about it, but I'm not gonna lie, I was thinking about it. So after that, I received a call, and well, I've been unsuccessful. So I was like feeling bad, but not that bad, because I feel like after every failure, if you have something to learn, it's already one step to do better later on. So they told me about the charge nurse went through about the three questions, not the first question, because it was something concerning about me, so there was no need to give me feedback on it. So basically, she went about patient-centered care. The way I answered, she said that my answer were good, but I just needed more to focalize on the patient. And it's true, because when I was answering the question, I was more, what will I do myself as what I will implement it, what I will do to provide person-centered care. But the senior charge nurse said that I would have maybe more be focusing on the patient perspective instead of a nurse perspective, nurse perspective, which I think that she is right, because patient-centered care is about patients, it's about all concerning a patient. And I think that in this occasion, I should have maybe focused more about talking about patient, the interest of a patient, knowing better a patient, what they like, what they don't like, how to help them, and all those good stuff. And I think that I did not do that enough, so that's why probably they think that my answer was not as like great as it could be, and it could have been much better. So I learned from that as well. And the third question was about a mistake. So they went through about this, and I realized that I made a big mistake, because what is the first thing you will do when you make a mistake? Of course, the first thing you're gonna do is to tell to the patient, to say that to the patient. So unfortunately, I did not mention that, although it's something that I will definitely do it, because this is happening all the time, not with drug medication. Thank God, it never happened to me. But you can just make a mistake. Everybody does make a mistake. So it's about when you do a mistake, the first thing I think you should do is to say that to the patient, because they are the one who kind of gonna be like facing the consequences of your mistake. So you need to inform the patient. Although obviously I knew that, but I never mentioned that. And most of the time, that is the first time you need to say. And sometimes my mom say that knowing something is important, but the best thing is knowing the right information at the right time, because I'm sure that the senior judge knew that I know that I need to inform the patient, but me not mentioning that at that time made like my answer, but so that is the first thing that I needed to mention, and I needed to mention that I need to phone the next of kin, which is the person that is responsible for that patient while they're in hospital. So I needed to mention the patient and the family, which unfortunately I did not mention. And I did not mention doing a day text, which is like one of the things that you need to do in case there is any accident or any mistake. Basically, it's a form that you need to filled up in case there is any mistake, and you just go through the question and you answer, and after you do a reflection on it, just to make your practice more better anyway. So I did not mention that, and unfortunately all other stuff that I've said about that question were right, but no mentioning those 2 or 3 things make my question no as good as it could be. So that is another thing that I learned that day. Those are all the stuff that I know, but I feel like not mentioning that was a mistake as well. And in the last question about a confused patient, I think that she said that I mentioned, I answered very well, because that is usually the stuff that I will do, and that they are all right. So what I learned about this interview is that sometimes less is more, because I've been a nurse for 4 years. So sometimes there's a lot of information. When you ask me a question, there's a lot of information I'm just ready to throw. But sometimes I feel like it's good to select what is really important, and to say that at the start of the answer when you answer questions. So for example, in patient-centered care, I should have focused more on the patient perspective instead of employee perspective, and that is the mistake. Even on documentation, the patient is the center of everything. That's why we always talk and re-talk about patient-centered care, and basically that is what's kind of the things that I learned. And I was thinking like to share that with you, because I think that this my experience might help other people, even like aspirant nurses, people that are undergoing to interview. And I think that it's gonna be beneficial for everybody is in the field, and it's gonna be even beneficial for other people that are not in the field, because I think that it's just an experience. I am so glad that I share this experience with you, and I think that definitely the next time I will take this feedback that I got to my next interview, and I'm so glad that I've done it. And what I was impressed in the word of encouragement I got in the end by my the senior charge who phoned me. She told me, don't give up, because there's a lot of jobs around there, and there's a lot of job waiting for me. So I'm glad that I've done it, and I would like to thank you all for listening to me. And remember to like the video, subscribe, like, share, comments, and just pass that on, because I think that it's gonna be beneficial for people that are like in the same pathway as me. And after this, I would like to say bye, and I hope to see you in my next video. Bye.